Welcome back to the AUA Inside Tract podcast. I'm Steve Hudak, chair of the AUA Young Urologists Committee, and today's episode features Dr. Nathan Grunewald and his perspective as a hospital-based urologist on the top 10 things I wish I knew before I started practicing, from a panel discussion presented at the Young Urologists Forum at AUA 2019 in Chicago.
Objectives for my talk are really to talk about the framework of priorities. As you start down this endeavor, this is really designed for those of you who are looking either for your first job or maybe you're looking to transition out of the one you have, identifying that framework of priorities. Strategies on how you can find those jobs that really do strike what can be a somewhat work-life balance that may be unadvertised, all right? And then looking for key contract points for a hospital-employed urologist. So as we say, you got to know my background here a little bit. I'm a non-traditional career in medicine. I did my undergraduate work in microbiology, immunology, but also business at the University of Wisconsin. I followed that by 7 years in the private practice or private nonprofit world where I was doing energy consulting and medical research development. And it was there that I decided I was tired of answering emails at a desk and really wanted to go more into medicine, which I knew I loved from the time I was 12 years old. And so I did med school residency in Milwaukee at the Medical College of Wisconsin, loved it. I am now an employed staff urologist. And what that really means is that I work for a health system or a specific clinic. You could still technically view employed, meaning that you're employed as part of a practice group, but I really work for the hospital in my scenario. And I work for an independent rural community hospital in Wisconsin. We're a bit of a unicorn. We have 33 inpatient beds, but we operate like a 150-bed hospital, and that's largely due to our surgical volume, which really generates a ton of revenue for us. So we're a bit different. And I created this service line at this institution. They weren't advertising for it. I specifically sought them out as a good institution, a good practice location, and asked, do you want a urologist? And like most places, yes, they do. And then in addition to that, I have an administrative role, so I'm not only just a staff physician, I also serve in the administration, and my role is twofold. One is to help develop the next round of physician leaders within our health system, but then also I have this creative role where literally my job is to know the business of medicine and healthcare and really help the institution figure out what direction to go in the future. It is a wonderful position to be in. I really do love my job, and that is no joke. And that is by design. This didn't happen by accident. This is the steps that I'm going to talk to you about. This is how I got to this point in my life. All right, so here's your current mindset. You're sitting out there all eager or anxious, and you kind of feel like a superhero like Arya. I won't tell you what happens there if you don't know. But you're also nervous. What am I going to do? What's my life going to be like? I just heard the call is terrible. It's supposed to get better, but you're also kind of inspired. You know, you have all this education. You've done medicine. You're learning medicine. You're about ready to learn healthcare, which is a very different animal. Medicine is healthcare is the industrialization of medicine, okay? So you might be a little timid hearing some of that, but hopefully you're thankful for what you have and the opportunity you have to provide to patients. You really are going to save lives. You will be the person that saves their lives. You're the staff. You made that decision. You intervene on that patient. That's an incredibly noble thing to do. So as you kind of struggle through this process, remember what you're really doing. And you're a young urologist, I assume, since you're in this room, and so there's much to come and much excitement going forward. So your framework of priorities, super important right now. Before you are out there gathering those contracts and discussing the finer points, you need to know your life goals. You probably have this in some kind of nebulous fashion in your head of what you want to do, but you got to sit down, you got to write it down. You got to find out what your family goals are. You got to figure out where do you want to go in your career. What are you really kind of hoping for? This is likely going to change, okay? You are going to try and figure out what would that work-life balance be if you could make it stay static, okay? And super important, if you have a partner, you need to include them in that discussion as you're writing these down. This is going to become invaluable when those contracts are in front of you and you start seeing these huge dollar numbers in front of you, and you're going to want to kind of drift towards that. you're going to want to come back to this list. It's going to be super important. And you have to have a long-term focus. You're going to have some short-term goals, but you're really looking into the future here as best you can with your partner, if you have one. And you're going to try and you're going to have major life changes here coming up. All right, new job, new friends, right? For most of you, your life has been dominated by educational-related friends. You know, undergrad, med school. Those are the majority of people you have. You're going to have a whole new set of friends once you start as a staff. You're going to have new money. And a lot of it as a urologist. With that comes some taxes. So realize that, 30 to upwards of 50% by the time you've taken out your retirement account funding and everything else, that's going to be your take-home pay. So as you're looking at these big numbers, realize what you're really going to have for disposable income isn't the same, okay? You're going to have a bunch of new job responsibilities. With that, likely for many of us, we have debt obligations that also factor into that. But you are going to have a whole lot more independence and a whole lot more free time. And it's a great place to be. The leash is going to come off, and you're going to really kind of be able to drive your future. So once you've kind of got all that down, prioritize. 1 to 10, whatever you want to do, you want that there because you're going to come back to this list as you start trying figuring out which one do you want to sign. So you've listed your priorities. Now, who are you? What does it look like as you're out there trying to find a job? Realize, and I'm sure many of you are aware, demand is way higher than supply for urologists in this country. This table is actually from the last year's AUA census. If you haven't filled it out, I suggest you do. It's super helpful for your organization and your advocacy work. But this shows you that 50% of the urologists practicing in this country right now are 55 or older. That cliff is coming. It's already starting. And so we are going to see the demand's already great. It's going to be even greater. And so as you're sitting there in your practice and the number of patients that you're going to be pressured to see, you want those to be quality visits. Realize this is there. So just this is the reality of the economics of healthcare in a supply and demand. Then you have the advertised versus unadvertised job. I just had a personal philosophy going into this that in general, unadvertised jobs are the ones that I was really looking for. I felt like the advertised ones where they were seeking out something they really needed and there was probably something going on behind the scenes. Not universally true. There are plenty of advertised jobs that are just fine. But I wanted to create something. I wanted to shape it and frame it in the way I had a philosophical way to practice medicine. And so that's where I sought out unadvertised jobs. So how do you find those? You likely have some sort of geographic idea of where you want to work. And so a super helpful thing to do is really just start looking in that geographic area for local groups, people that are already existing, find hospitals and clinics in those areas, health systems, state associations. You can actually search the AUA directory based on geographic locations to help you find names and email addresses and whatnot. You're going to make that list, throw it into some sort of spreadsheet to keep yourself organized. All right, super important as you're generating this list, and it's going to help you down the line do some more evaluation. And then just start reaching out. There's a variety of different mechanisms to do that. You can attend the meetings that already exist for some of those groups. You can come to meetings like this. But attending those meetings and networking is helpful. But this is something that for many people might be very uncomfortable, cold calling. That just literally means you are just dropping a line to somebody who you have no idea who they are other than they're a urologist in the area. Turns out, a lot of them are super happy to hear from you because many of them are probably looking for somebody. And you can just pick anybody in the group and send them an email or call them up or connect with them on social media, and you will likely get a response, or they'll at least get you to the person who makes the decisions within the group. If it's a hospital or clinic, look to the medical affairs office or the administration office. Super easy. Recruiters, kind of love-hate there. Recruiters don't always have your best interest in mind. Doesn't mean you can't utilize them, but I tended to shy away from them. But sometimes they have some good information as to what's available out there. As you go through this process, be cautious and gracious. These people that you're contacting in the future, they might be your colleagues. They might be your competitors, all right? So as you go through this process, know that in the future, these people you're going to have to work with, they may have self-interest at heart. They may be the junior person within the group or at the organization, and they see you as, oh, finally, somebody else that's going to be more junior than me. Let me get them here. And just realize that exists. It's human nature. They might be upset if you don't pick their group. All right. So remember kind of how you feel right now and how happy you are and stuff like that. Well, you don't want to generate some snitty letter from them being mad at you. So you really got to pay attention to that because you're gonna rely on these people likely. And the last thing you need to do is make enemies in this process. Leave your options open until you sign a contract. All right, until the deal is done, you never know what's going to happen. And so this is where being nice and friendly and being polite along the way is going to be super helpful. And then thank them afterwards. Many people wanted to know why I didn't choose them, and oftentimes I had a better fit. And I didn't need to go into details. And then know your friends. You have some trusted relationships outside of the individuals you're talking to within their job environment. Rely on those people. That objective sort of third party really looking at what you're talking about can be super helpful when you're dealing with some of these details and you don't want it to get too emotional. Call for me in general, frequency. These are things that you want to know. We've already talked about it. I personally find that my call is much better. Where I work in a rural community health system, it turns out that a lot of patients don't want to bother their doctors. That's not always good. Sometimes I need them to bother me. Like I need to know when you've got fever after a prostate needle biopsy or in chills. But sometimes they don't want to call us. They just don't want to bother us. And so for me, I find in an employed setting, I worked specifically with the ER doctors when I came on board. Here's how to handle gross hematuria. Here's how to handle stones. Here's the algorithm I would use and the protocol that I would use. They really appreciated that. They knew what I wanted. They knew what I was going to ask for when they called me anyway. So it made it much easier and actually decreased overall the number of calls that I received from them. You're going to want to know, some of this has been touched on already, so I won't go through, but clinic structure and OR structure, and what's your ancillary support? Do you have IR? Do you have hospitalists? It was a requirement for my employment that we had hospitalists on staff, which we did, and that they were willing to accept these patients from the ER and admit them. I wasn't coming in at 2 a.m. to admit an intractable stone patient when all they really need is pain control until I can get there in the morning. And I'm the only one. So they were super helpful about that. And there's good data that shows having hospitalists involved in the care of your patients is a good thing for their longevity. So I definitely insisted on that. And then pay. There's a variety of different models of pay. I personally am a salaried employee. I have zero interest in ever going into a production basis. This is a philosophical way I believe in practicing medicine. Not everybody agrees with that. But there's many different ways. If you have a production component, though, you need to understand what work RVU means and how that's assigned and how that can change during the duration of your contract potentially. So this is why, a cysto right now has X number of RVUs set to it, and that is sent by a national committee called the RUC, and Kyle up here sits on the RUC. This is a group across this country that fights over the number of dollars that are available, and they can change it. So you might sign a 3-year contract, and next year a 30% reduction in the RVUs for a procedure you do a lot of. That is simply going to be reflected in your pay. So the ideal way to do it is pick a valuation year and stick with it through the duration of your contract. At least you kind of know what you're getting. And then like previously mentioned about coders, I stay out of the coding world. Aside from when I first started, I made sure the coders understood and worked through things, but there are plenty of resources, experts within the field, even at the AUA, that coders can reach out to help code things. And then there are things like clawbacks. Clawbacks, one of them can be, imagine you take somebody to the OR, they even got prior authorization for that procedure, and in the end, the insurance company denies them. One of the clawbacks can be that you are on the hook for that. Not your fault. It was prior auth, everything. You had the right indications, but for whatever reason, they chose not to cover it in the end. In some clawback scenarios, the contract can say you have to give that money back. Avoid them at all costs if you can. These are really kind of negative clauses within contracts. We're seeing less of them, and salary survey data. Lots of other terms. Get involved for sure. Get an attorney to review your contract. Absolutely. You can expect it to cost you about $1,000. I can say many of the people I've talked to, it pays for itself over and over, not even just sometimes in your signing bonus. And then one last objective, just get involved. Super important. Advocacy is not a dirty word. I agree with that. We are the best informed for our patients to help them get better. We need to be at the tables that are discussing how we deliver healthcare in this country. It is a place where we have fallen off, and we've relinquished some of that. We need to get back to that. And then get involved in social media. Believe it or not, it's actually quite helpful in healthcare and in medicine. And there's a lot more urologists showing up on Twitter than in the past couple of years. And it's a great way to share ideas, connect with people.
Thank you for listening to the AUA Inside Tract podcast, an official podcast of the American Urological Association. For more information, please visit auanet.org.